Okay, good day everyone. This is Erudite Anatomy series. This is a place we make anatomy very easy and what's palatable. So today we are going to start a journey on what gross anatomy, and we want to start with first of all anatomical terms. Okay, anatomical position and terms. So first of all, what is anatomical position? Anatomical position is if someone asks you to stay in anatomical position, the first thing that you're going to do is you just place your palm behind your limbs by your side. I don't know if you can see me. Place your limbs by your side and the palms facing up. Do you understand? So when the palms are facing up, we say that we're in what anatomical position. Then the next thing is let's look at anatomical terms. So anatomical terms, we're going to look at, let's say, 8 of them or thereabout. Let's list them. We'll first of all start with what? Medial and lateral. Okay, medial and what? Lateral. So medial and lateral is as regards a reference point, especially at the midline. So let me just say this is what? Midline. Let me say this is a midline. Then let me say this is point A. Then this is okay, let's say this is point A. This is point B, sorry. And this is point A. So this one that is closer to the midline is medial. While this one that is further away from the midline is what? Lateral. So in anatomy, I will say that A is medial to B, while B is lateral to what? While B is lateral to A. So I believe it's a simple something. Then let's look at the second term. In the second term, we'll look at flexion and extension. So flexion and what? Extension. So flexion and extension. Flexion is normally where there is a joint. So if I'm reducing the angle in a joint, I'm flexing. Then if I'm decreasing the angle, so if I'm decreasing the angle, I'm flexing. If I'm increasing the angle, I'm what? Extending. So flexion is what? Decreasing an angle. Extension is what? Increasing an angle. Then the number 3 we are going to look at is what? Abduction and adduction. So what is abduction and adduction? Abduction is what? Moving away from the midline is abduction. Are you seeing me? Moving away from the midline is abduction. While coming closer to the midline is what? Adduction. Do you understand? Okay. Then the fourth one I'll say is what? Circumduction. What is circumduction? Circumduction is what? Collection of flexion, extension, abduction, adduction is what? Circumduction. So like now, is normally is on the popular MCQ question. Someone can ask you which particular joint can we do circumduction. It's basically at the hip joint and what? Shoulder joint. So let me say this is what? Flexion. This is an extension. This is what? Abduction. This is adduction. So this is circumduction. Then the next one, I'll just say number 5 is let's say proximal and distal. So proximal is superior, distal is inferior. Do you understand? So if I say something like this is A and this is B, so the one that is up is superior or proximal, the one that is down is inferior or what? Distal. Then I think then the last but not the least, let me finish up here. Let me finish up here. Okay, is if I say okay, let's say number 6 is what? Supination and pronation. So supination is when the palm is up. Look at it. Then pronation is when it's down. Do you understand? Very simple. So supination. So we normally say that kings are um, pronators, while receivers are what? Supinators. Okay, let's say givers are what? Pronators. So because when you want to give, you have to pronate your palm. Then while receivers or beggars are what? Supinators. So we normally pray that we become supinators, not what? Sorry, pronators, not what? Supinators. Then I think the last but not the least is number 7 is contralateral and ipsilateral. So contralateral, okay, still, okay, let me say this is when two things are in an opposite side of the midline. Okay, look at now. So the A is what? When they are in the same in an opposite side of the midline, we say that is what? Ipsilateral. Sorry, contralateral. That means opposite side of the midline. But for example, now let's say C and D are what? C and D are what? C and D are what? Ipsilateral. When they are the same side of the midline is what? Ipsilateral. So for example, now look at this this is my right ear and this is my right eye. So my right eye is ipsilateral to what? My right eye is ipsilateral to my right ear, while my right ear is contralateral to my left eye. I think it's very simple. Okay, so thank you. This is the main thing that we have to know in what anatomical term and position. So a quick recap. Anatomical term is when you stay like this with your palms facing up. Then anatomical terms have medial and lateral. Medial is when something is closer to the midline, while lateral is when it's farther away from the midline. Then flexion is when you are decreasing an angle. Extension is when you are increasing an angle. Abduction is when you are moving away from the midline. Adduction is when you are moving closer to the midline. Then circumduction is a collection of flexion, extension, abduction, and adduction. And I normally tell you that circumduction is normally seen in hip joints and what? Shoulder joints, a popular MCQ question. Then the proximal and distal. Proximal is something when something is up, or is when something is above, while inferior. Distal is when it is below, that is inferior. Then supination when the palm is up. You can normally use the UP in the supination as up. When the palm is up, then pronation when the palm is facing downwards. Then contralateral is when they are the same opposite side of the midline. Then ipsilateral when they are in the same side of the midline. Thank you.